Today we're going to give you the need-to-know info about kidney stones. So what are kidney stones? According to the Mayo Clinic staff, the medical term for kidney stones is renal lithiasis or nephrolithiasis. Kidney stones are small mineral deposits that can form in the kidney as a result of buildup of mineral acid salts. Also, according to the Mayo Clinic, kidney stones are calcium stones, usually in the form of calcium oxalate. This oxalate is located in your liver. High intakes of specific vitamins such as vitamin D, which is found in milk, can spike these levels in your urine. Long story short, a kidney stone is basically a hard mineral-like material formed in the kidney or urinary tract. Did you know there are 4 main types of kidney stones? Calcium stones are the most common types of kidney stones. They occur in forms known as calcium oxalate and calcium phosphate. They are caused by a high pH level in the urine. The second type are known as uric acid stones. These stones form when ingesting the chemical purine, which is found in many meats and fish. Purine causes highly acidic urine, and if concentrated enough, it can settle and form the stone. Struvite stones are made up of a combination of magnesium, ammonium, and phosphate. With the aid of bacteria from infections in the urinary tract, these stones can form. Cystine stones are the only form of stones that are inherited from a disorder called cystinuria. The disease allows 4 amino acids to enter the urine, which is what creates the stones. How are kidney stones acquired? Kidney stones can't be transmitted, but they can be acquired. There is actually no single definite cause behind how one acquires kidney stones, but there are many things that can increase your chances of getting them. When there isn't enough liquid in your urine, crystal-forming chemicals aren't diluted enough. According to the National Kidney Foundation, these substances become very concentrated and kidney stones begin to form. According to the Mayo Clinic staff, some other risk factors include family history of kidney stones, not drinking enough water, living in warm climates and sweating more, high protein diets, high sodium diets, and high sugar intake. What are some symptoms of kidney stones? According to Curran, a writer for the National Institute of Diabetes, Digestive, and Kidney Disease, some symptoms include urine that is dark or has a foul odor, severe pain on either side of the lower back, sometimes pain in the ribs, blood in the urine, nausea and vomiting, prolonged stomach aches, and a fever and chills. How do kidney stones affect the different body systems? Kidney stones are very problematic to the urinary system. Most small stones will pass through the kidney, ureter, bladder, and urethra with no problem. On the other hand, large stones can cause severe problems. They can get large enough to irritate the lining of the kidney or ureters, which causes blood in the urine. Larger stones can also block the path of urine exiting the body, which can be very painful. Large stones like these, that won't pass on their own, need to be surgically removed before serious damage is done to the urinary tract. How are kidney stones relevant to society? According to the National Kidney Foundation, kidney stones are relevant in our society because they affect around 10% of our population. This means the chance that you know somebody who has been affected by kidney stones is rather high. This disease is sure to hit close to home for many people. How much of the population is affected by kidney stones? According to the UCLA Department of Urology, about 10.6% of males are affected compared to about 7.1% of women. About 11.2% of overweight males are affected compared to about 6.1% of those who are fit. And about 9% of US citizens are affected compared to about 5.64% of global citizens. How are kidney stones treated? According to NIDDK, National Institute of Diabetes, Digestive, and Kidney Disease, one of the best and easiest ways to prevent kidney stones is to drink plenty of water each day. They recommend that you drink 2 to 3 liters per day. If you aren't fortunate enough to prevent kidney stones, there are still treatment options. Smaller kidney stones can be passed through urination, but in the case of larger kidney stones, doctors can try to break up the stones with ultrasonic waves so they are easier to pass, or they may be removed surgically.